Good afternoon. Welcome to the City of Toronto's COVID-19 media briefing for Monday, August the 31st, 2020. Joining us today is Toronto Mayor John Tory, Toronto's Medical Officer of Health, Dr. Eileen de Villa, Toronto City Manager Chris Murray, and Toronto City Councillor and Chair of the Board of Health, Joe Cressy. Mr. Mayor?
Brad, thank you. And just before I begin, may I just acknowledge, as I know Dr. de Villa will, that today is World Overdose Awareness Day, and I participated in a flag raising outside here at City Hall today, just to underline really the urgency of this situation, to underline the degree to which we are paying as yet inadequate attention collectively to what is a crisis in our city that has taken many, many lives last year and this year, and that I just hope that today will be an opportunity for everybody in government and outside to reflect on this preventable loss of life and the measures that we can continue to undertake to do better. It's been almost 6 months now since we began locking down our city to stop the spread of COVID-19. We took emergency action to save lives. It has worked, and over the last few months, we have all worked together to slowly reopen our city as safely as possible. Toronto's coming back, and we're coming back strong, though it is a gradual process. Today, Dr. de Villa and City Manager Chris Murray, together with the Chair of the Board of Health, Councillor Joe Cressy, will be outlining the plans that we have in place and the work that is being done in order to prepare for a resurgence of COVID-19. This means strengthening the case, contact, and outbreak management at public health, making sure we have focused health plans on key areas like schools and long-term care homes, and continuing to build up our supply of personal protective equipment, just to name 3 crucial areas. These plans are based on the same clear and fearless public health advice we've had throughout this pandemic from Dr. de Villa and her colleagues, advice which we have accepted and acted upon without exception, and that won't change. All of these plans are focused on making sure that we minimize the resurgence as much as possible. Put another way, because I believe that honesty and transparency has been crucial to the progress we have made as a city collectively inside and outside of government, those very same experts we have relied upon so much and so well say some resurgence is inevitable. The challenge is to plan well and to minimize it. I want the public to know that throughout the summer, the city's fight against COVID-19 has never stopped, and we know it will never stop until we have a vaccine, and even then, there'll be more work to do. But we have learned from this fight so far, and we have worked to make sure that we can reopen with confidence based on public health advice with the proper safety measures in place. Based on public health advice, we've taken many actions already that will help to fight a resurgence. We have made masks and face coverings mandatory on the TTC, inside public places like stores, and in apartments and condo common areas. Our mask policy is working, and it will continue. We have worked to put measures in place to have contact tracing and other such measures in place, proper spacing at restaurants and bars. Those policies are working with good compliance, and thank you for that. We have encouraged physical distancing in parks and opened our recreation facilities with a number of public health safety measures in place, and those will continue. And we will continue to follow public health advice and make adjustments as needed to help reduce the spread of COVID-19 and continue to save lives. I know people are nervous, and I know that confidence we once had in moving about our city just in the ordinary way, whether it's going to work or going to school or just being out and about, I know that that confidence has been shaken by the entire experience of COVID-19. People tell me this day after day when I'm around the city. I want the people of Toronto to know that we are working to do everything we can as a city government based on public health advice to help people come back with confidence, come back to a more normal life and to the parts of their life that they treasure. That doesn't mean you won't have to wear a mask or that you won't have to wash your hands. It does mean that we're making sure, with all the work that we're doing, that the TTC continues to provide a clean, safe, and reliable ride, as it has throughout the pandemic. And it does mean that we're focused on helping protect schools, protect long-term care homes, protect workplaces and child care centres, and of course, more particularly, all of the people, young or older, that are in all of those places. We have said many times that COVID-19 is a marathon, not a sprint. But the public should know that we have the plans in place for the next phase of this long marathon. As I've often done, I extend my sincere thanks to all of the staff members in the broadest sense, all of those involved in the public sector, and the experts who've helped us throughout, including with these plans. And most important of all, I thank the people of Toronto for their exceptional cooperation, caring, and compliance. Let's make sure that we all stay the course. And it's now my pleasure to ask Dr. de Villa to talk about this plan and to give her report for today.
Thank you, Mayor Tory, and good afternoon, everyone. First, I would like to take a moment to acknowledge that today is International Overdose Awareness Day. It's with a heavy heart that I recognize that we continue to see so many loved ones in our community die from these preventable deaths. The COVID-19 pandemic has had a serious impact on people who use drugs, their family members and friends, and the service providers who work so hard to support them each and every day. My team and I remain strongly committed to working with others to improve our collective response to this crisis. Turning our focus now to an update on our local COVID-19 experience, I'll share what we've learned, what lies ahead for us, and how we can work together to make important choices over the next few months to stay safer as we live with this virus. Science is hard at work to defeat it. Reopening is happening. School is about to start, and fall is coming. And in the weeks and months ahead, we're all likely to be coming into much closer contact with one another. We have to balance all of these things to minimize the potential risk to ourselves and the people around us. Amongst the good news, and there is good news, is that we have done well in terms of managing virus spread and protecting our healthcare system from being overwhelmed, as was the case in many other major cities. Nonetheless, we still have daily COVID-19 cases and community spread. Today, I'll tell you what we've learned here at home and from around the world, and about the ways we're getting ready for the resurgence of COVID-19 in the weeks and months ahead, and the things we need you to do as Torontonians. But first, let's look at the figures on COVID-19 today. Since the beginning of the pandemic, we've seen a total of 16,044 cases, an increase of 40 new cases since yesterday. While the majority of people recover from COVID-19, in public health, our focus is on preventing COVID-19 infections in the first place. Our objectives throughout this pandemic have been to minimize the loss of life and serious illness, to reduce the spread of COVID-19 in our city, preserve the capacity of our local healthcare system, and to mitigate the negative social, economic, and broader health impacts of the pandemic. The only way to achieve these objectives is for all of us to keep washing our hands, watching our distance from others, wearing our masks, and avoiding crowds and close contact. We are at an important point. The first stage of this outbreak is behind us. You can see it here on this graph, which shows the course of COVID-19 in Toronto, rising rapidly from the start of March, peaking in April, and then a general decline in the numbers from May onward. We have been more fortunate than many places, but our statistics still represent a tremendous amount of illness, loss, and suffering in our city. The choice we all face now is what we will do as we move toward the fall and winter phase of COVID-19 in Toronto. There is no question that we will see resurgence. Amongst the best projections we've seen are those from the Center of Infectious Disease Research and Policy, based at the University of Minnesota. They have described 3 possible scenarios. Scenario 1, a series of repetitive small waves that occur consistently over the next year or so, then gradually diminish over time. Scenario 2, a large wave in the fall or winter with smaller subsequent waves thereafter, similar to what was seen in the 1918-1919 influenza pandemic. And scenario 3, a slow burn of ongoing transmission and case occurrence, but without a clear wave pattern. There is no way to know what will happen exactly. However, my team continues to listen to emerging scientific evidence and consider the latest facts to protect your health now, this fall, and this winter. This summer, we brought on additional staff to do case and contact tracing so that we have more people to help with this critical work that reduces virus spread. We've also delivered refresher training to the existing team. This is precise and delicate work, and we've done everything we can to be well prepared for the fall. The experience of other places tells us we need to plan for COVID-19 cases as school returns. My team is working with the province, our school boards, and schools to provide advice, training, education, and support around infection prevention and control measures to prepare for a safer return to back to school. We're also hiring additional nurses to provide more on-the-ground support. Another important investment in infection prevention and control is the establishment of Toronto's Voluntary Isolation Centre. We are continuing discussions with the federal government to create a space for people infected with COVID-19 who cannot isolate safely at home. Establishing this voluntary isolation center will be an important step for our city in our efforts to limit spread and keep you safer. We've also learned that certain neighborhoods have been hit much harder by COVID-19. So to tackle spread in these areas, we're deploying community outreach rapid response teams, multilingual teams to connect directly with people, agencies, and organizations working in these communities. We're also continuing to work with our provincial colleagues to support community pop-up testing sites in these areas of our city. In long-term care, we're implementing a liaison response model as a way to enhance our support for long-term care homes and partnerships between public health, local hospitals, and the province. And we are ensuring a data-driven response, and we continue to conduct detailed data analysis to better understand risk factors associated with COVID-19, including socio-demographic characteristics and infection patterns. Taken all together, we know that COVID-19 spreads readily from person to person. It's easier to catch than the flu, and COVID-19 is unpredictable. There are no guarantees about the kind of outcome you may have if you get it. We know that more serious outcomes like hospitalization and death are more likely in older adults with pre-existing conditions. And while younger people tend not to be as severely impacted, there are some who'll get really sick. And we still have some questions about children and how easily or not they can spread disease to others. The bottom line is that we should avoid taking unnecessary chances, and instead, we should do everything we can to prevent getting COVID-19 or spreading COVID-19. You may ask, why is this important? This is important because the best available estimate shows that just over 1% of people in Ontario have antibodies to COVID-19. This means that the vast majority of us do not have immunity to COVID-19, and we are still vulnerable to infection. It gets more complicated because 20 to 40% of cases either don't show symptoms or only show very mild symptoms. This means your mild illness may spread to someone else and become their serious illness. This is why it's crucial to act in ways that limit the chance that you could make someone else sick. It's important to be clear that with reopening, there is an increased risk of exposure, but you can take steps to minimize your risk, just as we did at the beginning of this outbreak. This is why I urge you at every opportunity to wash your hands, keep your distance, and wear your mask. But let's be honest, living like this isn't easy. But there are many examples of what happens when we don't do our part. For one, in Maine, at a wedding earlier this month, there were 65 guests, and that led to 60 infections. But only 22 of those infections were amongst guests. The infection spread to a jail 300 kilometers away and a health facility 150 kilometers away. One woman who didn't even attend the wedding died as a result. Resurgence of COVID-19 cases results from being in closer contact as we go about our lives. Based on what we've seen in other places, resurgence in Toronto is inevitable. Even New Zealand, hailed as one of the leaders in COVID-19 containment, has had to mobilize to fight cases that have popped up. We are planning based on certain assumptions. While scientists are working with speed and determination, we still don't expect highly effective treatments in the very near future, and we aren't planning on vaccine availability before the spring of 2021 at the earliest. Until then, we have to find a way to live with COVID-19 in our city. Our experience in the first months of this pandemic has helped us prepare for COVID-19 resurgence in Toronto. It isn't a question of if we'll see more virus in Toronto. It's a matter of when. This is a critical time for us, but we still have time to make a difference in terms of what happens next. So all of us have to keep doing our part. We know that wearing a mask is one of the best ways to take care of each other and to protect people around you. And now, there are some studies which suggest that wearing a mask may protect you too. But please, remember that the greatest protection is what we do together. How we learn from our experiences, the experiences of others, and how we turn this into actions to protect your health. How we show our support for the healthcare workers who cared for the sick, and all the essential workers who kept us fed, kept us moving, and who provided the services that simply had to continue. And how we show respect for people suffering and experiencing loss from COVID-19. I'm saying it again because it cannot be said enough. Everything that we do at Toronto Public Health to keep you safer depends on your actions in your daily lives. So in the many months ahead, please build one bubble and protect it. For now, A bubble is made of 10 people, not many bubbles involving those 10 people. Please, get a flu shot, this year more than any. Please avoid crowds, closed spaces, and close contact with people outside your bubble. And always, wash your hands often, watch your distance, and wear your mask. You may be tired of hearing me say, wash your hands, watch your distance, and wear your mask. But please, don't get tired of doing these things. These are the things that we must resolve to do every minute of every day until we can gather as we used to and think only about how much we're enjoying ourselves. And working together, I believe we will see that day. With that, I'll now turn it over to City Manager Chris Murray.
So thank you, Dr. de Villa. To start, the city's divisions, agencies, and corporations conducted a review of the response to the first wave in order to identify what worked well, best practices from other jurisdictions, challenges, and practical actions to improve our preparedness for the resurgence of COVID-19. We've consolidated these findings to create our COVID-19 Resurgence Plan. The city has learned a lot over the last 6 months and is working to ensure we are as prepared as possible for the resurgence. We have developed responses and escalation protocols to quickly address emerging needs. We've established several administrative bodies designed specifically to centralize decision-making and expedite our response, such as the Strategic Command Table, which meets weekly, our Business Continuity Task Force, the Redeployment Team, and the Personal Protective Equipment Task Force, in addition to strengthening existing bodies like the Emergency Operations Center and Senior Leadership Team to effectively help Council govern this situation. In terms of plans, the city will continue to deliver essential and critical services in any scenario. Depending on severity of resurgence, non-essential services may be reduced or temporarily canceled, as per our response in the first wave. As the Mayor said, we'll be guided at all times by the public health advice. That's what has protected us to this point and helped save lives. The city is ready to be nimble and act quickly. Here is an overview of some of the current plans we're preparing to implement if needed. First, childcare. Increased health and safety protocols have been implemented across childcare facilities. In the event licensed childcare centers are required to close, the city is prepared to return to operating free emergency childcare to essential workers. This is with the help of the province of Ontario. Long-term care homes. They remain focused on adherence to and implementation of Ministry of Health, Ministry of Long-Term Care, and Toronto Public Health guidelines to keep residents and staff members safe. Priority actions include continuing to implement infection prevention and control, and lessons learned in the first wave, ensuring stability of staffing resources and allowing designated essential visitors, caregivers into the homes to support residents during outbreaks. In terms of parks and recreation facilities, increased health and safety protocols are in place for programs, facilities, and park amenities. In the event recreation facilities and park amenities are required to close, the city is prepared to move quickly and scale back to critical services. To respond to vulnerable populations and emergency social services, the city is prepared, if need be, to adapt facilities to create food distribution sites, shelter system expansion, and respite resources. In terms of bylaw enforcement, municipal licensing standards bylaw enforcement, which leads a coordinated enforcement team made up of 9 city divisions and Toronto Police, will prioritize provincial orders and city bylaws pertaining to COVID-19, along with emergency and health and safety service requests. Homelessness support. Our Shelter Support and Housing Administration will continue to protect people experiencing homelessness and further strengthen the city's approach to provide permanent housing as the best solution to homelessness. Protective measures such as physical distancing will remain in place in shelter facilities. In terms of homelessness support during cold weather, as the weather becomes colder, plans will include maintaining additional winter space and enhanced street outreach services to assist in providing access to shelter and housing for people to move indoors from encampments. It is worth noting that the city has been in continual winter operations through the pandemic and will continue to adjust as needed to address any additional measures required. In terms of support for vulnerable residents, it's important that you know the city's community coordination plan brings the city together with almost 400 community agencies to coordinate support for vulnerable communities and enhance joint planning between the city and community sector. This work continues now, and the city is prepared to scale up measures in response to a resurgence. City buildings and facilities. Our civic centers, City Hall and Metro Hall will remain closed to the public for the near future to continue to help mitigate the spread of COVID-19 and protect the health of the public and city employees. The city will ensure that buildings' occupancies do not exceed 30% in the short term. This capacity would be scaled up or down based on infection rates and public health and occupational health advice. Protecting our city employees. In order to provide the critical and essential services to the residents of Toronto, we need to ensure we are also protecting our valued employees. That means ensuring their workspaces and environments are safe to work in, as well as providing mental health supports and regular communications. So in summary, our planning doesn't stop here. We will continue to conduct reviews and identify opportunities for improvements to our approaches. This process will be ongoing and iterative as the city continues to respond to COVID-19. While it is responsible to have these preparations in place, I remain hopeful we can continue to keep our numbers low. I must say I am incredibly proud of our Toronto Public Service. From day one, they have responded in the manner in which all of you would hope. It is our job to earn your trust and confidence, and as Chief Peg would say, we have this one. We have demonstrated how much we care about our communities, and I know we are ready to take on any future challenges that face us. And with that, I'd like to turn it over to Councillor Cressy, our Chair for the Board of Health.
Well, thank you, Chris Murray, Dr. de Villa, and Mayor Tory. I find these days that nearly everybody is asking the same questions. When is this pandemic going to be over? And what's going to happen this fall and winter? On the first question, this pandemic will come to an end. Not next week or next month, but it will end. The unprecedented global efforts of our medical and scientific community to develop a vaccine should give us all real hope. As for this fall and winter, at the City of Toronto and Toronto Public Health, we've spent months preparing for COVID resurgence. Now, we have to be upfront with Torontonians. In the coming months, there will be more cases, there will be associated outbreaks, and sadly, there will be deaths. But that doesn't mean we should assume or accept a drastic spike or a new series of significant waves. Learning to live with COVID still circulating, it may be the new normal, but accepting a drastic spike of cases doesn't have to be. Our task here at the city and with the other levels of government is to minimize COVID resurgence and its associated harms. Now, over the last 6 months, our team, and you've just heard it here, has worked nonstop to not only respond to this pandemic, but to plan for the future. The City of Toronto and Toronto Public Health within it have COVID resurgence plans that are detailed and comprehensive. And I'll say, as the Chair of the Board of Health, just a few words on Toronto Public Health's plans. They include public health measures like requirements for masks and physical distancing. Our plans involve relentless testing, tracing, and isolating. I can tell you that at Toronto Public Health alone, we have more than 700 staff working on case and contact management the largest such unit in the country. We're focusing on higher risk settings with enhanced supports and teams dedicated to shelters and long-term care facilities, child care centers and schools, workplaces, and high transmission neighborhoods. And our data collection and analysis work has shown that some groups and some communities have been disproportionately affected. In turn, our resurgence planning is following that data by developing an isolation facility for people who can't safely self-isolate at home. We're conducting partnerships with others to ensure targeted and mobile testing, and we've developed new multilingual community outreach rapid response teams to support those hard-hit communities. Finally, we're also working to roll out an aggressive flu vaccine program to protect the capacity of our healthcare system as we head into the fall and winter flu season. I won't belabor all the measures that have just gone through, but I will say that these are truly unprecedented times. And at the City of Toronto, we've pledged since day one to do everything possible to keep our residents safe. And we asked you, our residents, to do your part. You know, I know we've all made sacrifices, but our efforts have worked thus far. And as we prepare for a resurgence of COVID, at the City of Toronto, our commitment remains the same today. We will do everything, absolutely everything, to keep you safe. And I know that you're tired. Like all of us, you desperately want this period of time to end. And this moment in time will end. It will come to a pass. And when it does, our city will have shown that we are stronger and more resilient than ever. With that, I'll turn the floor back over to Mayor Tory for questions.
Thank you, Councillor. Just before we take questions, a number of staff are on the line for any reporters who wish to ask of the TTC, Toronto Library, our shelter system, bylaw enforcement, parks, forestry and recreation, children's services, and long-term care. First question is to Francine Copin from the Toronto Star. Go ahead, Francine.
Oh, hi. The detailed plans for the resurgence, do they include the possibility of another lockdown?
So I'll take that question, Brad. Thanks, Francine, for that question. I think we have to consider whatever is necessary in order to best protect the residents of Toronto. We are certainly hoping that it doesn't come to that, but I think we have to follow the best available evidence, and that includes based on our experiences or what we've learned from our own experience and what we're learning from other jurisdictions. So we know that it does take a series of public health measures to actually bring virus spread under control, but I can't emphasize enough how important it is that each of us does our part. At the end of the day, you know, public health, us at Toronto Public Health or any public health authority can only do so much. We certainly have some science to bear, and we can bring data, and we can certainly put into place public health measures as we have done. But actually the impact of those measures, the impact of anything that we do, actually does rest on each and every one of our residents doing their part with washing their hands, watching their distance. That I cannot emphasize enough. Physical distancing we know works. And as well wearing masks when physical distancing particularly cannot be maintained. I would just remind people as well that it is important, if you are sick, to stay home and to get yourself tested if you do develop signs and symptoms that are consistent with COVID-19 infection. And if we do all of these things, as Councillor Cressy just said, we will eventually be able to put this behind us.
And a follow-up question. So it sounds like we can't rule out the possibility of a lockdown, you know, if things get bad again. Is there any chance that this fall, this autumn, won't be worse than what we've already seen?
So, Francine, it's an excellent question. And as I tried to make clear in my remarks, nobody can really predict what will happen. We know that there are some reasonable projections that are out there. The ones that I described talked about 3 different scenarios. And in previous pandemics, we have seen waves where in the fall season, there is significant activity. And our greatest experience is with pandemic influenza. But we are seeing in other jurisdictions now that there is some increased activity, particularly for those who went through their first wave of their respective outbreaks earlier than us. This is still something very much in development, and again, the extent to which we see big waves or what kind of activity we see in the future still comes down to what each of us does together and what we're able to do to maintain that distance, to wash our hands, and to wear our masks to limit spread.
Okay, thank you. Next question is to Albert Delatalo from Global News. Go ahead, Albert.
Hi, my question is for Mayor Tory. I understand that residents of the Broadway Avenue temporary shelters are moving out this week. What's next for these residents?
If you're referring to the residents of the shelter, first of all, I can confirm that all the residents have been moved out, effective, I think, the end of last week, from the Broadway buildings, which were always meant to be for temporary use based on arrangements made with the owner of those buildings. Many have been, over the last couple of weeks since the date was selected to wind that facility down on Broadway, those buildings have been relocated to permanent housing. I'm pleased to say that, because that always is the objective with people. Others have been relocated, and so our objective remains the same as it is for all people who experience homelessness in the City of Toronto, which is to permanently house as many as possible, and we've had much greater success than people acknowledge in doing that over the course of the pandemic. And then for those who remain and need support and care from the city, to care for those people while at the same time respecting the need to make sure we maintain safe and secure neighborhoods. And that is a dual responsibility we take seriously, and we've been trying to do everything we can in the context of that part of the city to make sure we achieve both of those objectives.
And a follow-up, for those who do continue on to other temporary shelters, how can the city ensure that they don't become overcrowded?
Well, we've shown during the course of the pandemic no hesitation whatsoever, and perhaps Marianne Bedard will want to address this, but I don't think it's not that complicated in the context of what we have done. We have had no hesitation whatsoever to take whatever number of facilities we need to take, whether it be apartment buildings that aren't in use, hotels that are empty because of the pandemic, and to make use of those, as well as to reconfigure some of our existing shelter spaces to make sure we keep people safe, that we support them, and that we respect our other responsibilities in terms of neighborhoods and so on. And so we will continue to do that as we go through. We are hopeful, obviously, that we can permanently house more and more people as time goes on, so that they will not be the responsibility of the shelter system anymore. But I think we've shown something we said at the very beginning of this pandemic, namely that the people who are the most vulnerable people in our population in Toronto will receive the support and care they need during an extraordinary circumstance, and that policy will continue.
Marianne, anything further you'd like to add, please?
Thank you, Brad. Yes, just following up on the Mayor's comments. We have established a shelter standard now about the need for physical distancing in the shelter system. So it is a requirement for our shelter providers to maintain physical distancing, for there to be a 6-foot distance between beds, or to have people in single-use hotel rooms currently. So we are making sure that we maintain all of those measures, as the city manager spoke of earlier, through the winter, to ensure that the shelter system is able to manage.
Thank you, Marianne. We go next to Lena Latafat from CP24. Go ahead, Lena.
Hi there. We know the City of Toronto has offered to help the TDSB with extra space required for smaller classes, offering the use of libraries, museums, community centers in the city. Mayor Tory, if you're able to provide an update and tell us if anything has been finalized, or what parents can expect. We understand the city has identified 24 facilities that could be made available.
We identified a number of facilities with the help of our city staff and with the help of the Toronto Library organization, and those offers were made, and they were made on a kind of preliminary basis on the basis that the school boards had to then sort out where the need existed and whether the space we offered matched up with the space that was needed. And it's our information that they're going to be getting back to us in the next day or so to indicate what their response is to the offer that we made, and obviously they may have some further requests to make of us, and we'll see at that time. But we have been and remain ready, willing, and able, to the extent possible, to help with this challenge that the school boards face to make sure that the kids are kept safe.
What are you able to tell us then, Mayor, about how many facilities that could be made available? And what about city parks and how they'll be used for outdoor instruction, maybe?
We said from the beginning that city parks were available, of course, to the school boards and to school groups as they would be in the ordinary course, and that we would do so without the need for permits, which ordinarily wouldn't be required for that kind of purpose anyway. As for the offer that we made with respect to other public spaces in recreation centers, libraries, and so on, there were dozens that we said could be made available, and we indicated that subject to some changes to our own programs, which we would have to consider, that there could be others. And so we're now awaiting the response of the school board, which we expect imminently, and depending on what they have to say, we will obviously either make space available, or if they don't need it, we won't have to, and we could adjust our offer if there's some things we could do that fit with their requirements. So we're trying to help in any way that we can, but obviously doing it with a view as well to maintaining the programs that are valuable to kids and families and seniors and others across the city.
Okay, thank you. We go next to Ashley Legasic from News Talk 1010. Go ahead, Ashley.
Hi, everyone. Thank you so much for taking my question. You all have been quite vocal and gone quite hard on the preparation the city is doing for a resurgence today. What does the modeling look like for our second wave? When can we see some updated modeling around the second wave that's more number specific?
So Ashley, I'll take that question. I think we'll try to come back with some data a little bit later in the fall, and I know that there are several different groups working on exactly this issue. But I think we need to be very, very clear here. You know, we can make predictions and we can make projections, but fundamentally, you know, none of us can say with certainty what we should expect in the fall, except to say that as people mix more with each other, as we get more interaction, and certainly as our weather cools and as we have to move indoors, we should expect to see COVID-19. We know that most of us remain vulnerable to infection, and therefore we should expect to see more COVID-19 activity, and it still rests on all of us to ensure that we're putting into place those measures that we know work. And this has to do with watching our distance, washing our hands, wearing our masks, right? Avoiding that close contact, especially in those crowded, enclosed spaces. These are the things we know work in terms of controlling COVID-19 and reducing its spread until such time as science brings us those effective treatments and, ideally, a vaccine that actually prevents the infection in the first place.
Follow-up, Ashley?
Thank you. Yeah, thank you. My second question, Mayor Tory, I wanted to switch gears a bit and discuss Cafe TO. I spoke with a restaurant owner today who says if the city committed now or at least really soon to reintroducing Cafe TO in the spring and summer of 2021, it would be some much needed relief, and it could be a lifeline for restaurant owners who are going to go through a rough winter. So could you commit to that right now?
Well, I want to, and I'm certainly looking at the program at the moment as having been widely successful. But I think we owe it to everybody involved in the city to take a look at it on an expeditious basis once it concludes, which I think is as late as November. We hope the weather stays good enough for people to be able to use these extra patios until that time. And, you know, make sure that we refine it and that we examine it and look at all the different facts in terms of business, in terms of all the other considerations. And so I really want to be able to repeat that program next year, but I think it's responsible for us to take a look at the facts and take a look at the experience, make the modifications necessary, and then be able to announce something very early on. I'm spending a lot of my time these days, you know, actually consulting all kinds of different people about how we can support businesses, small businesses generally, but also including those in the hospitality and restaurant industry. And this will be a part of an expeditious review of that so that we can say something about it quickly.
Okay, thanks. We go next to Dan Drigo from Global News. Dan, go ahead, please.
Just a question for Mayor Tory there. Mayor, are there any concerns that the incident in Little Jamaica over the weekend could cause any further strain between the Black community and Toronto police services?
Well, first of all, can I say, as you know, that this matter is in front of the SIU, and we will await their report as to exactly what they conclude happened there. I will just say I was deeply disappointed in the fact that a cause that is well worth supporting, and one that I have supported with my actions and with a number of meetings and other visits that I've made to Little Jamaica, was something that unfortunately was overshadowed by incidents that may or may not have had anything to do with that demonstration on the part of people who care deeply about that part of town and about, in particular, some of the black-led businesses. And so I would just hope that what we can continue to do is to work away at taking what has been a double whammy for a lot of those businesses, namely the construction of the LRT, which has gone on for years, plus the COVID-19 impact, and try to do what we can to help keep those businesses alive and help keep them on their feet. The investigation will proceed into what happened over the course of the weekend, and I hope we'll learn from that. What happened that brought the police there, what happened in terms of the police and their activities, how the activities of some civilians, I think, might have helped, and what the testimony is of some of the citizens that were there, and that will all put itself into a report from the SIU that will help us to learn better about the policing aspects of this. But in the meantime, I really think we should keep focusing on the challenge that has been faced by what is a very historic and important part of our small business community in Toronto, not just important to the Black and Caribbean community, but important to the whole community, because it's a part of our history and an important part of our history, and I intend to keep my focus on that and await the SIU report.
Follow-up, Dan?
Thank you, Mr. Mayor. Follow-up again for you as well. Just surrounding the recent announcement for body cams, will this lend themselves to the transparency that some in Toronto are seeking within the police?
I will tell you that, and I've said this before, I'm somewhat mystified at the fact that I think in the first part of my time in office and as a member of the police board, there was a great demand for body-worn cameras as an element of and a tool to promote greater accountability and transparency, and I believed that would be so. Now it seems to be more in fashion to oppose this, and I will say that what we've been told at the police board, and I intend to be holding them to account for this, is that not only will they provide that accountability and transparency, but they will also pay for themselves in the context of having more efficient policing, in the context both of how the complaints process works, because you will now have a video record, but also in terms of just all the note-taking and whatnot that goes on, which will be made better by a video record. And so I believe very strongly that this is the right thing to do. I believe that sometimes you have to do the right thing even when people have adopted a different opinion, or some people have, and I think this is going to prove to be very valuable in terms of accountability, the rebuilding of trust, and the increased efficiency of the police service. And to me, that makes it a reasonable investment to make at this time, and I'm looking forward to seeing them roll out. The pilot project we had overwhelmingly showed that the whole relationship between police and people was improved in the perception of the people themselves, and that there were benefits to this. And so that's why we did the pilot project, and now we're going to have the reality of these cameras being rolled out, which I think will be of benefit to the community and to the police and to the rebuilding of trust, which is so important right now.
Okay, thank you. Final question is to Mark McAllister from City News. Go ahead, Mark.
Hello, everyone. First, to Dr. de Villa, perhaps Mr. Tory, if you could follow up as well. What is going to be the trigger? What's that one moment during this resurgence that you're talking about that will kickstart all of the things that you're talking about today? Are we looking at some sort of trend that has to begin, or something other that will make it all start?
So, Mark, the items that we've described, the actions that we've taken so far don't need a trigger. We are already doing these things. We have hired more staff. We've refreshed our training for case and contact management. We're supporting schools. I read an entire list of activities that we're absolutely doing and that we've already done in many cases to be ready for increased activity, which we anticipate seeing this fall. And I think that we should be very clear that we will expect and we should expect to see more COVID-19. As I've mentioned already, we know that most of us are not immune to COVID-19 and the virus is still very much circulating out there. So I think it is inevitable that we will see more COVID-19 activity in our community. Our question is, can we keep it at a low enough level that all the public health measures are able to work as effectively as possible? And can we keep it at a level so that we can keep most of us as safe as we possibly can? given that we don't have immunity and that we are still waiting for science to provide us with effective treatments and an effective and safe vaccine. So when we're talking about what we're looking for in terms of changing course of action, you're familiar with our monitoring dashboard, so we're constantly watching our COVID-19 situation here in the city. We look at a number of different indicators, some of which have to do with our healthcare system and their capacity to manage cases, some of which has to do with the public health system capacity, but importantly, what are we seeing in terms of virus spread and containment, and what are we seeing in terms of our testing results and % positivity on our tests. So all of those indicators, which we're constantly refreshing and updating on our website, are the types of indicators, and it's the kind of monitoring that we're going to continue to do throughout the fall and throughout the winter in order to inform our decisions. So what we're looking at, you're seeing too on our website. So I think that's the best I can provide you right now, Mark. I wish there were a simple measure to say a single indicator that dictates everything. It's not quite like that. We have to look at the sum total of our indicators and assess the situation as it arises.
May I just add to that the following, which is the trigger is going to be the very same trigger that we had before. When we were presented in March, as the numbers were going like this, by Dr. de Villa and her team, with public health expert advice that said that the consequences of inaction would be thousands more people. We've already seen untold tragedy, even in our city, where I think we did a good job of trying to limit that, but we've seen untold tragedy. When we saw that, we turned immediately upon that discussion to say, what can we do to do better than this? And so I can just say it will not be political pressure. It will not be, with great respect, a City TV exclusive headline that causes us to change course if we have to do that. It will be the advice of Dr. de Villa and her team and the provincial people with whom we've worked very closely and the federal people that will provide us with the expert health advice and the evidence that we need to take any action that they recommend. And we have accepted that advice without exception since the beginning of this, and we will continue to accept that advice because that's why we have experts like this who provide steady, professional, informed advice, and that is why I think we have made some progress on this, although we still have a long way to go.
That's all. Thank you.
Okay, Mark, thank you. Thank you, everybody, for joining us. That concludes today's briefing. We'll meet here again on Wednesday, September 2nd. Have a good afternoon.